Hi everyone. Sorry that I'm late by a few minutes for the live today. Thanks everyone for joining in. Hi. Hello. I'm so sorry that I'm a little late to start the live. I actually went for swimming and yeah, there was some issue with the lift and stuff, so I couldn't come back up in time. Hi, I'm good. How are you? So thanks everyone for taking time out to join the session today. Very interesting session, something that I wanted to do last week, but we couldn't have Dr. Debraj Shome come for the session. I'm good, Shweta. How are you? I'm looking forward to doing the live session that we're supposed to do sometime soon, but I'm really enjoying your sessions, Shweta. So Shweta has been doing a lot of sessions with a lot of experts. Do follow her. I keep posting some of the things that she's doing. She get a lot of experts to come onto her Insta Live and share information. So that's amazing. So do go follow her. Okay, so I'm just okay. Righty. So I'm just waiting for Dr. Debraj Shome to join us. And hi.
Hey, hi, how are you doing?
I'm good. How are you?
Good as well. Good to see you.
Yes, finally. We're doing the session that we were supposed to do last week.
I know, my apologies on that one. And I know you're going to give me a hard time on that one, but I just got the Singapore and the Indian times mixed up.
That's okay. You're not a cabin crew, so you can be forgiven. But
What's up? How's it?
You got the time zones mixed up, or if you were a cabin crew aspirant and you got the time zones mixed up, then I'll be super angry.
No, I'd still be surprised with the amount of traveling I do, but shit happens. That's life. Anyways, go ahead. How have you been?
That is true. I'm very good. So quite a few people actually joined in today. We have about 46 right now, and I think we should have a lot more people joining in.
Hello, how are you, all of you? How's it going? And hope we can be of help to you and help you forwards in your aspirations and in your life.
Awesome. Why don't you do a quick introduction so everyone can get to know you a little bit more? Although I think by now most people that follow me definitely know you. But
my name is Debraj Shome, and my biggest achievement is that I'm the friend of this celebrity called Nidhi Belani. And I am a facial plastic and cosmetic surgeon. I practice at multiple hospitals in Mumbai. We run a chain of centers called the Aesthetic Clinics, but we also have centers in Mumbai, Hyderabad, Kolkata, Delhi, Bangalore, and Ahmedabad at this moment. So 6 cities in India. Obviously, with the lockdown, we are caught up in Mumbai. So the other centers are non-functional and dysfunctional at this point. But generally, we are there in 6 cities. So thank you for inviting me, Nidhi, and thank you for everyone who's sparing their time on. I see a lot of friends. Hi, Meenakshi. I see. So there are a lot of people who've logged in. So thank you very much for giving us this opportunity to solve your issues and hopefully take you forwards in whatever you would desire.
Awesome. So I just want to quickly share with everyone as we speak. One of my students is already going under a plastic aesthetic surgery for his scar removal. He has a scar here, and he was actually rejected in Qatar Airways because of the scar. And as we speak, he's already going through the treatments with you. So do you want to share a little bit as to how did that go?
Fabulous, really. We've always been a big hub for treating aspiring cabin crew as well as existing cabin crew. In fact, some of my friends who've been in SpiceJet have been gracious enough to call me for their grooming sessions as well. And all in all, this gentleman that we are speaking about is doing really well. So he's grown back some hair. He's gone ahead and treated a chin scar. He agrees that the chin scar already looks about 60% or so better just 2 weeks later. He's undergoing the lasers right now. I frankly think I don't see the big deal of having a chin scar. I mean, I can't see why being a cabin crew is a big deal. In fact, I was turning around and telling him, why are you spending so much money? You're a good looking guy. Forget about it and just go and become an actor. Yeah? If they don't want you to be a cabin crew because you've got a chin scar, they love actors with extra fingers, chin scars, everything. So let become an actor and screw becoming a cabin crew. Just forget it. So, but his mind was set up on being a cabin crew, and I'm grateful that we could help it. Yes, our April 24. I'm hoping that's your birthday. Scars on the hand too, so you can go ahead and treat a lot of those things. But let's follow a structured pattern, guys. Let's just let Nidhi take all the questions and ask us the questions instead of us just jumping off and on with all the messages which are coming in.
Absolutely. Before we get into this, for anyone and everyone who wants to know how to deal with scars, and if you want to go for treatments, then Dr. Debraj Shome would be the person that you can get in touch with later. I'll post all the details as to how you can get in touch with him. But for today, we wanted to focus on basically two things because, we were talking about this one of the days, and we were discussing how having confidence is really important in life, in everything that we do, and not just cabin crew interviews, in life in general. And there are a lot of people who do not feel so confident because they feel their skin is not the best looking. Because I'll be really honest, as important as it is to feel confident from the inside, I think it's equally important to feel confident on the outside. I'm a true believer of inside-outside beauty. And I believe if there are options to take care of your beauty on the outside, you should definitely go for them as well. So I'm probably going to touch base on three things that people can do to be more confident on the inside. And then maybe, Dr. Debraj, you can share with us three things that people can do in terms of like keeping their skin healthy and stuff. And then we can take up some questions maybe at the end, 15 minutes or so. We can take up the rest of the questions. If I was thinking we could do something like that. Okay, so I think Dr. Debraj's screen is a little bit on.
Yeah, I'm there.
Did you? Okay, so I was just saying that maybe I'll share some confidence-related tips, and then you could share some skin-related tips, and then we can take up the rest of the question because a couple of people want to know about feels.
So the most important thing that for people who do not know me, you should also be aware that I am an author of a couple of best-selling books, those which have been in the top 10 on Amazon for the past couple of years. And the first thing that I tell people is the most important thing is to treat what's inside. And if you can treat what's inside, the outside takes care of itself. Think of some of the biggest superstars of Bollywood. They may not be the best looking. It's not what's outside, it's what's inside. If you love yourself and you love what's on you, over a period of time, people also tend to fall in love with you. But if you don't love yourself, there's just very difficult to love even the best looking person in the world. So as a result of which, I think what's inside is far bigger than what's outside, and you got to be strong inside. So the one thing that I say as a facial surgeon is that we operate on the face, but actually we treat the brain. And so we are the neurosurgeons who don't operate on the brain. We treat the brain by operating on the face, because if your face looks good, and if you can go ahead and feel good about yourself on a daily basis, you will do good. And remember, what I always say is thoughts become things. Whatever you can think of can go ahead and manifest in your life. So as a result of which, making sure that you look your absolute best and making sure you're at your most confident on a daily basis will ultimately attract the best things to you in life. So from that perspective, it's incredibly important to feel good about yourself. And if it's just a small scar, etc., which is not making you feel good, I think it's not about the scar. It's about the rest of the stuff. It's about making sure that you feel good about yourself. So it's not a little scar. It's the impact that the scar is having on your brain. And that's why it's important to treat it.
That is true. So, I mean, that's one of the things that I wanted to share. And in fact, I kind of touched base on it the last time when you couldn't join. Right next to my bed, there is this big mirror that I have, and it's right next to my bed. So when I wake up, After doing my prayers, that's the first thing that I look at. And I'm not even kidding. Like, I actually spend like a few minutes actually saying positive thoughts to myself, giving myself a lot of self-love, like telling myself that I'm beautiful inside, outside. And, that is one thing that actually motivates me to carry on for the rest of the day and feel so confident about who I am. And that really, really helps. So on that particular day, if I wake up and if I have like a small pimple or something, I'm already motivated to do something about it because I'm already in love with the person that I see. And if I feel that this pimple or the small bump or the scar is going to be in the way of me feeling the way I feel, I probably should do something about it. So that's like an extra motivation. But it starts from within. You have to love the person that you see in the mirror. And I'm a true believer of that. I actually do like positive affirmations.
Most people on this call will know who Gary Kasparov is. Gary Kasparov was the world chess champion for a long period of time and the number one chess player in the world. Gary Kasparov was 5 years old, and this is part of his autobiography. So he was 5 years old when he started writing down 5 words on his mirror and saw it every single day. And those 5 words on Gary Kasparov's mirror were, if not you, then who? So if we can keep telling ourselves every day, if not you, then who? If not you, if you won't be the chess champion, if you will not do well in life, if you will not get what you want, then who will get what they want? And if you can say, if not you, then who, looking into your eyes with conviction, more often than not, the universe will make sure that you get whatever you want. Hi, Korjesi, how are you doing?
Hi, Korjesi. Yeah. Absolutely. I so agree with you. And I mean, a lot of people amplify it a little bit more. And that was the second thing that I wanted to share. When a cat looks into the mirror, if the cat sees a lion, and if that's what you see at yourself as, you have the ability to amplify yourself when you look at yourself. You don't have to actually stop yourself at what you are. You can always amplify your strength. You can look at yourself in a bigger picture, and that will drive you to be more confident and feel more motivated. And I was just sharing this with someone just this afternoon, So one of my students was sharing with me that I feel very nervous because there are so many other good people in the class and they're giving such good answers. And that makes me feel very nervous. So, and it's really amazing to listen to something like that because, how it is that we never think about, well, there are a lot of people who may not be giving as good as answers as I am, but I'm actually only looking at people who are doing better than me. So this comparison that we keep doing without amplifying our strengths actually put us down at the end of the day. So I was just telling them that, you've come for coaching with me. That doesn't mean that, I'm the only person, I'm the best person who can give you coaching. I'm sure there's a lot of other people who can actually coach you so much better than I do. But should I stop believing in myself because there are so many people who are better than me and just stop doing what I'm doing and be nervous about it and not be confident in what I am doing because there's so many better people out there? So I think that is one thing that we constantly do. We constantly keep putting ourselves down by looking at other people who are doing so much better and not amplifying and working with our own strengths, and which I think is really, really important, especially in my case. Like that works very well for me to project that confidence. Okay, I think his screen is a little bit hung as well. But yeah, that's what I want to share with all of you guys. Confidence is a skill.
I think it's super important. I think it's super, super important. And ultimately, whether it's the best career, whether it's the best building, whether it's the biggest monument, they were all created in the mind first. And unless you're able to create it in your mind, it's impossible to create it in reality. Which doesn't mean that if you create it in your mind, it will get created by itself in reality. But it does mean that you have to first create it in your mind. If you don't believe in yourself, chances are no one's going to believe in you. So as a result of which, it is incredibly important to have the belief, to retain the belief and take that forward. So that is super, super important in order to make sure that you can get whatever you desire, because the desire has to come in the mind first and then you have to work towards it. So I think that's very, very critical and important.
That's true. So Ricky, that's what we were hearing, that don't put yourself down because there are other people who are better than you. It's about believing in yourself. And if you feel that you're not good at what you're doing, then do something about it. Work towards it. And a lot of people come to me and tell me, I got rejected because of the scar. And my next question to them is, so what did you do about it? And then they would tell me, oh, we did nothing. So it's like, okay, and what are you expecting to happen at the end of the day? The scar is just going to go off on its own. I mean, you've got to do something about it, right? If you want to achieve something. Sorry, I just have to attend to somebody at the door. I'll be right back. So sorry.
I think while Nidhi is away, I also think that it's an incredibly important and great time in human history. Today, plastic and cosmetic surgery has the ability to solve all our problems. We are at an incredible time where whichever problem you have, the solution is in front of you. Today, the computing power of your phone is more than the computing power of the biggest supercomputers about 40 years ago. So from that perspective, we are at an extremely privileged time in human history, both from a medical standpoint, from a plastic surgery, cosmetic surgery standpoint. You just need to decide, I need to get this sorted, whether that's a scar, that's an open pore, that's whatever. The technology and the human know-how today has exponentially increased to the level where we can solve every single problem that you have. It might be a bad looking nose or it might be whatever. The thing to understand is you got to make your intention and you got to make the movement in that direction. You can't stay at home and hope that everything will come flowing in through the door to you. Unless you step out of the door and go ahead and get things towards you, things may not happen. But the technology is there. There are amazing things which the human race has today, which wouldn't have been possible even 10 years before.
Okay, I'm sorry. I'm just going to report someone who's been saying abusive words in the chat. So
I saw that too. And dude, if you don't know how to tolerate yourself, and if you don't know how to behave in a public forum, just because the internet gives you the ability to be anonymous, if you want to go ahead and abuse people and talk about their boobs, I don't know what's so great about boobs. Everyone has boobs, right? Even men have boobs. So I don't understand what's the big deal about it. And if you don't know how to respect people, you should just get the fuck out of here and the fuck out of everywhere else. So I don't know what thing this is about people coming in and abusing women. I am not at all, I don't understand men who abuse women at all. I don't understand what is the big deal. Yeah? It's a part of any woman's anatomy. I mean, a woman has breasts. Your mother had breasts, asshole. That's why you were born. And that's why you could go ahead and get milk from your mother. But if you don't understand that big thing, you should just be on a porn site. Don't come on an Insta live.
I've already blocked that person. Thank you for sharing your opinions.
I wish you hadn't blocked him. I would have given him another piece of my mind. Anyways, go ahead.
Korjati is here. Korjati, you can share your experience later if you want to. And at this point in time, I mean, going back to what we were saying, definitely starts with a belief, intention, taking actions on intention. I personally also believe there is one very important thing that we lack in general, which actually brings down our confidence a lot. And I think that's really important and something that people really don't pay attention to. So I think having clarity in life is really, really important. We just run after things without having any clarity, what we really want in life, what we really want to do. So I think even before we actually setting intentions, I think it's really important to have some clarity. What is it that you really want to achieve? Set a goal for yourself. Make that goal a little bit relevant. Is it actionable? Is it measurable? So I feel having clarity gives a lot of confidence in whatever that you want to do in life or whatever path that you want to choose. Because when you clear what you want to do, right, even if things would probably put you down or you would face obstacles, you would actually never actually feel demotivated about yourself and about what you want to achieve. So I personally feel that is really, really important to make yourself confident. Whenever you're doing something. Do you agree to that?
Before going in for any pharmacological treatments or for any laser therapy, people think that, skin is going ahead and Ricky, thanks for your advice. Appreciate it. So going ahead and, looking at things in a manner which is basically everything has a pharmacological treatment is not appropriate. You don't have to go ahead and have a pharmacological treatment or lasers for everything. You can definitely go ahead and work out. You can eat the right food. You can make sure you have enough water. especially if you're going ahead and becoming a cabin crew, you've got to understand that you are staying in a pressurized environment for a long period of time. So getting used to having at least 8 through 10 glasses of water every day becomes very important. It's a high stress work environment. Making sure that when you apply your makeup, coming back and removing the makeup, removing the oil from your face is very important. If it's a very long flight, then making sure you even wash your face and reapply makeup in the middle of your flight is very important. Ultimately, it's about making sure that your pores can go ahead and breathe. Because if you don't go ahead and make your pores breathe or take care of all of that, then even the best surgery cannot help you. So surgery and pharmacological elements like drugs and lasers will only help certain things become better. But unless your habits are good, if you have open pores and if your habits have been bad, you've not been exercising, you've been smoking, it doesn't matter how much laser you do, because ultimately the skin will start going back to where it came from. So that's very important.
That's true. I think we can take up some of the other questions as well at this point in time, and then along the way we can share.
There was a question about open pores, and so I wanted to address that. That was one of the first questions which came in. Open pores tend to
let you know what the questions are, but yeah, go ahead.
Yeah, so open pores occur on the skin. They are the first signs of skin aging. When you see open pores on the skin, it's a sign that your skin is giving you that your skin is aging. So that is because the collagen which tends to form the skin tends to break up, and that gives rise to these open pores. So the first thing to do if you see open pores is look at your lifestyle. Are you getting enough sleep? Are you getting enough exercise? Are you going ahead and eating the right food? Are you getting enough nutrients in your diet? Are you smoking? If the answer to all of this is positive, only then should you then come for treatment, because there's no point in getting laser done and going back to smoking, right? So from that perspective, get all of these basic habits right. Make sure you exercise 30 minutes a day. Make sure you drink lots of water. Make sure you remove the makeup whenever you can. Then come in. And then what we do for open pores is carbon dioxide laser resurfacing. Carbon dioxide laser resurfacing is like the Salman Khan of lasers. You literally can go ahead and get best quality lasers given such that collagen starts developing in your skin. So if collagen is breaking down in your skin, thanks Nitika, if collagen is breaking down in your skin, the carbon dioxide laser resurfacing can actually cause your collagen to redevelop. And it's like playing a rewind button on your skin such that you're going back a few years in your age. And so those sort of things can be done. In fact, carbon dioxide laser resurfacing works very well for small marks as well. So some scars, you will need surgery. But some other scars like small hand scars, etc., just doing a couple of sessions of carbon dioxide laser resurfacing does a fantastic job of making sure that the skin scars can become much more obliterated. They may not completely disappear, but they'll become imperceptible enough such that you can use foundation to actually hide them. So this is very common. This for us is a routine day's job. And there's no reason really, if a scar is bothering you, there's really no reason to live with that.
Absolutely. So I think that answers the question about the scar in hand as well. There was this question about skin health boosting peels from Shweta. Would you want to maybe put some light on that?
So,
what that is?
So peels help. There's no question about it. Chemical peels help. But the ones which you can use it at home, the do-it-yourself peels are not useful. I'll tell you why. Because chemical peels which need to work, like the glycolic acid peels, need to be at least 25 to 30% concentration of glycolic acid. Those you will not get in the market to use on your face directly at home because they can burn the skin as well. So you will have to go to the doctors to get the glycolic acid peel done. What you get over the internet or what you get it as a do-it-yourself at home sort of a peel are the 5 or 10% glycolic acid peels. For that, what I have to say is, why are you wasting money on the peels? Because papaya itself contains glycolic acid. Use the papaya on your face and that will do the job of peeling as well. So why are you unnecessarily going ahead and wasting?
Okay. So while he's coming back, thanks everyone for coming up with your questions. And this is the time to ask questions. And we're not just here to recommend treatments, but
experts. Sorry to interrupt. There are experts in every field. The reason why people want to go to Nidhi to get trained is because she's been there, done that. People just can go on the internet and get free advice, but that free advice may not be curated advice. It may not be advice appropriate for your CV. It may not be advice appropriate for your skin. Therefore, see a good doctor, make sure that you spend money, make sure you spend time, so you get the appropriate treatment. Do it yourself peels will not do anything. Yes, you can apply the papaya on your face because it will not cause any harm, but that doesn't necessarily mean it will cause the best possible effect as well.
What about bumps? A lot of times, and someone has a question as well, sometimes when people have like small bumps on their face, what causes it and what could be some of the things that people can do to actually take care of it, apart from living a healthy lifestyle and, taking care of your diet, I believe.
Eric, what I said was that papaya can be used as a peel for the face, but papaya will not go ahead and do a very good peel. So it's better to get a chemical peel done from your doctor. Abhilasha, even one cigarette, I always turn around and say good skin, good hair, and smoking are like two parallel banks of a river. They can walk together, but they can never meet. If you want to have good quality skin, it's better not to smoke even one cigarette. Because the fact of the matter is, today there is so much pollution. You're smoking 10 cigarettes in any case in the air in major cities in the world. Why would you want to smoke the 11th one? So coming back to the small bumps that you were talking about, Nidhi, the small bumps on your face usually happens to comedogenic or acne prone skin. And it's important to use good face washes. So benzoyl peroxide face washes, you can go to your chemist. They'll give you your benzoyl peroxide face washes. In India, it comes under the brand name Acnesol. I don't have any financial disclosures to make regarding Acnesol. They don't pay me to say this. But basically, you can use Acnesol or one of these face washes twice a day. But, this do-it-yourself over the internet sort of treatment is not going to work for everyone. Because everyone's skin is different. Everyone's genome is different. The food that I eat works beautifully for me. But if I started giving the same food to everyone else, it doesn't necessarily mean that that food will work for you as well. Because it's an interaction. When you take a medicine, you take a Tylenol. So Tylenol can work in this manner, right? It can solve your headache. It may not work at all in you. Or it may actually give you such a bad raise reaction that you may actually die from the raise reaction. So how a drug or how food or how anything works in you has to be titrated for your individual body. You cannot just go ahead and pop a pill in just because it worked for your friend and just because Dr. Debraj said on the Insta live use also benzoyl peroxide face wash, it doesn't mean it will work for everyone. So stop taking shortcuts, guys. Stop taking shortcuts with your image, with your skin, with your everything. I mean, even today, for instance, when I want to get into personal learning, I learn from the best in the world. I pay a couple of $100 in order to get the best possible sage advice, in order to listen to Richard Branson speak, because that is what motivates me and that's the fuel I need to put into my brain so that things can work well. So there is no shortcut to learning. You have to invest. People invest in flats, but the biggest investment you can ever make, guys, is in yourself.
Absolutely. So for everyone, I'm going to save the live later and it's going to be available on my Instagram. So don't worry about that. I think this is a very common thing that I've heard from a lot of people. And I know a lot of people who used to face this issue. When you apply makeup, after a while, it starts looking very oily. And for some people, it becomes very dry and flaky. And of course, I understand that choosing the right makeup does play a huge part. But apart from that, is there anything else that people can do, especially when the makeup turns oily after 2-3 hours?
See, the first step is knowing what is your skin. Second step is knowing what is your makeup and what does it contain. Third step is understanding the interaction between the makeup and your particular type of skin. These are complex things. I mean, people do a trial and error sort of a basis, but these are complex things. You need to understand makeup. You need to understand your skin before you decide what is going to be good for you. So from that perspective, I think first choosing the right makeup. Second, if I were you, I would go ahead and wash makeup off every 4 to 5 hours. I know it's a pain and some of you wonderful cabin crew take half an hour, 45 minutes, an hour to get ready. But the fact of the matter is, it's like, imagine you're wearing a raincoat the whole day. The makeup on your skin is like raincoat on your skin. It's going ahead and blocking all your pores. It's not letting your pores breathe. If you're going to go ahead and do that to your skin, then how can you complain when your skin responds and reacts angrily by putting up acne?
Yeah. I mean, unfortunately, when people go for interview, they might not be able to do that. But I completely agree with you on the fact that if given a choice, you should actually not let the makeup stay on for the longest time. And of course, knowing your skin and knowing the right makeup is really important. I mean, if I have oily skin, if I go ahead and apply like a really oily moisturizer, then obviously my makeup's not going to last any long.
Oh, no, why makeup? Why makeup? For instance, sunscreen. Which sunscreen works in everyone? I could speak for an hour and a half on that because I have tried 5 or 6 sunscreens which haven't worked for me, and it's taken me a lot of effort to find the one sunscreen which works on me. So as a result of which, the thing that you have to understand, guys, is that a human being.
By the way, on that note, I have a question for you. You know, a lot of people, when they want to try different products, for me in particular, uh, okay, I think there's a little bit of an issue with the internet.
Human beings are all unique, right? Human beings don't have a chip within them like a Qualcomm chip, which can be in everyone. So no one size fits all. And that's the beauty as well as the difficulty of treating a human being. So therefore, you will have to experiment with products and most importantly, go to a good dermatologist, understand your skin type, understand what makeup will work for you, and then get started on it. If makeup is a daily part of your daily routine, I can't believe that you're not interested in the routine enough to at least find out once which makeup will suit you better.
I have a question here. So for me, right, when I try a different product, like if I'm going to try a new product, for me, I don't usually like to test it directly on my face. Usually I will test it on my hand. Do you think that's the right thing to do? I mean, does it?
Yes. Yeah. Again, the question answer is it depends. If you apply it on your skin, you will see if you have any allergy to it, because any allergen will then not affect your face. But at the same time, Nidhi, your skin on your hand is very different from the skin on your face. The thickness, the oil glands, the way it responds is all very different. So as a result of which, ultimately, after you've tested it for allergy, you'll have to put it on your skin in order to decide what is needed. I wanted to answer this question by Asiya, where it was, how can we treat pimple scars and dark spots? Like I said, Asiya, I think you joined in a little late, but carbon dioxide laser is a great way to treat pimple scars. Many people say they have used laser, but not all lasers will work. As I say, the attention is in the details. It's the carbon dioxide laser. And some types of acne scars or chickenpox scars are so deep, or even physical scars are so deep, you may even need surgery followed by the laser. So therefore, no one size fits all, unfortunately. For dark spots also, carbon dioxide laser works really well. But if they are not very dark, then we can give some skin whitening agents like kojic acid, etc., which can go ahead and be applied at night so your skin becomes a more even tone.
Great. I think there's one question that I wanted to, and I think you sort of addressed this the last time as well. A lot of people come to me with some self-harm scars as well, a lot of times. And vitamin E capsules, does that actually help in lightening those kind of scars or any scars?
Lightening, yes. But let's say the scar today is a 9 on a 10. Can you expect to take it to a 2 on a 10 with vitamin E? Sorry, you can take a bath with vitamin E. You can drown yourself in a bucket of vitamin E. It's still not going to go down to a 2 on 10. It will reduce it from a 9 on 10 to a 8 on 10 in terms of the amount of causing some amount of lightening of the scar. But if you need a definitive treatment and it's a deep scar, how much vitamin E can you apply? And frankly, if you're going to keep applying vitamin E over a year's time, isn't it better to go and do a laser? It might cost you less than taking the vitamin E pill every day. And not only that, if you use the vitamin E pill every day, how much time are you losing? There's also time cost of money, right? You are not getting into your job because your scar is so bad. They are not taking you in. You're sitting and applying vitamin E. You didn't get employed for 2 years. Think about what you could have earned in those 2 years as well, right? So take the time cost of money as well.
I think that's one thing that you've said very nicely. A lot of people don't look at the opportunity cost. They only look at the amount that they would probably spend, but they don't realize that in not wanting to spend that amount, they're actually losing out on so much of an opportunity cost. So that's a very good point mentioned there. Opportunity cost
is the most important cost in life. At some point when you guys become reasonably successful and have a little bit of money, you will realize that money can be earned only if you have time and health on your side.
Yeah.
The one thing which is a finite concept that never changes, even for the most wealthy person in this world, is the day will have 24 hours and you have a set number of years to live. So don't live it living someone else's dogma. Don't live it living someone else's life. Please lead your own life, and please understand every day that you have not moved towards your goal, you've wasted one particular day of your life. And that's a big opportunity cost, because you don't know how many days in life you have left at this moment. I wanted to answer Shweta Chopra's question on Q-switch laser. Q-switch laser is a different type of laser. So what is laser? Laser is light. Light can be different colors. You can have white light, blue light, green light, infrared light, etc. So similarly, lasers can be of different wavelengths. Q-switched Nd:YAG laser is a type of laser which is used for very specific things like skin whitening and can also be used for tattoo removal. Now, the thing is, you have to go ahead and understand what each laser is used for. I don't think, Shweta, it should be your job to understand the type of laser. You need to find a practitioner. You need to find a guy or a lady who understands lasers well and then gives you appropriate treatment depending on the type of laser your skin needs. Just doing a Google research and deciding that Q-switched Nd:YAG laser is the type of laser for you may not be the right way forwards. I would love to fly planes, and I've been reading on the internet how to fly planes. Should I start to fly a commercial airline now? I doubt whether that will be the right way to do it.
I think it's more just for the information perspective.
No, I understand. And I don't mean any disrespect. I understand completely. It is because of the information perspective. That's why I gave the information. That's why I respectfully told her what it's about. But I'm also using it to inform other people that there are limits on what information, general information like this on an Insta live can achieve. So,
it can be quite dangerous too. So,
no, I don't want anyone. So there are.
So yeah, I mean, too much information sometimes can be a little bit dangerous too. So I guess it's important sometimes to know, and sometimes good to not know a lot of things as well. But having said that, I think we'll take up a few more questions when he comes back.
Nowadays, Nidhi, the reason we get worried is once we started talking about Botox and someone actually ordered some botulinum toxin online and decided to inject themselves. So therefore, I make a caveat and I'm like, this is not a do-it-yourself. This is not a bakery show or a cooking show where you can go make the cake tomorrow at home. Please don't do that. That's all I'm saying. I'm trying to protect my license.
Sure. What about a lot of people who face issues with acne and pimples and stuff like that, and they actually say it's hormonal? What kind of part hormones play in general when it comes to skin-related issues? And
especially in women, we are seeing a lot of hormonal problems, and possibly the reason for that could be that most girls are now reaching their menarche and are starting their periods at the time that they are 8 or 9 years old, but they are going ahead and actually getting married and having kids when they are 30 and 35 years old. So this distance between the time you start your first periods and when you have your first child, plus the sort of stress that modern living is causing, is leading to a lot of hormonal problems in women. We are seeing a lot of polycystic ovarian syndrome or PCOS because there are cysts which are developing in a lot of women. Now, the other thing which is happening is, I don't know for better or for worse, but most women have decided that the way to embrace feminism is to embrace all the wrong things that men used to do, which is go ahead and smoke or go ahead and do drugs, etc. All of these things combined are leading to huge problems in hormones in women. And when women have hormonal problems, that leads to increased hair on the hands and feet. It leads to increased hair fall from the head and a lot of oily skin, which can go ahead and cause pimples, etc. So from that perspective, it is very, very important to treat these hormonal problems. Ultimately, if you're developing acne, the actual cause may be a hormonal problem. And what you should know is that it might in fact impact your fertility also in the future. So it is very, very important to get these treated. And any good skin specialist or dermatologist or plastic surgeon or cosmetic surgeon will actually get your hormones tested when they see a skin problem so that they can evaluate whether you will have any fertility issues also in the future.
Okay, that's a good sharing. Thanks for highlighting that. I mean, yeah, I guess most of the issues at this point in time, the questions still revolve around pimples and acne marks, actually. A lot of people share that, after the acne is gone, it leaves like a stubborn mark on their face. Is it something that can be just treated with like an over-the-counter cream, or
No,
is there?
no. See, if you've developed a mark, it's gone below the epidermis, which is the topmost layer of the skin, and has gone deep into your dermis. It's not possible to treat majority of these scars just by going ahead and using over the counter creams. Lasers, etc., will be needed. What I will also suggest is, in the interest of time, Nidhi, because we are running out of time, what I
Yeah.
will also suggest is maybe all your fans and followers could suggest specific topics. And from next time onwards, when we do this on a monthly basis, we can actually have one topic every time. So as a result of which people can get all problems on that particular issue solved. So that will be useful.
Yeah. I think that's a better idea. We could pick up just one thing and we could just talk about everything deeply, so people have like more information. Uh, so yeah, in your opinion, basically, it has to be laser removed if the scar is left after the acne is gone.
So I think I'll have to cut this short because I will be now moving into some patient care.
Sure.
We are past the time, but at the same time, I'd like to request anyone, if you've got any questions, you can please direct message either Nidhi or me on our Instagram channels, and we remain committed to try and assist you the best way we can and do all we can to ensure that you fulfill all your dreams.
Sure. Thank you for coming over and giving us your precious time and advice. I really appreciate it. So please go ahead, take care of your patients, and I sincerely hope that people have been able to gain more information and knowledge, and I'll share all the relevant details with them. I'll probably stay on the live for a short while more with them just to...
Thank you, Nidhi. Thank you for your time, and God bless everyone. Bye.
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 All right, guys. Thank you so much for staying on the live, and thank you for your questions. I think that's a very good suggestion. So this is what Dr. Debraj Shome and I was thinking to do. We're probably going to make this into a monthly thing, because I realize a lot of us have a lot of issues when it comes to scars, skin-related issues, hair fall, hormones, or for that matter of fact, even if you're not a cabin crew and you still want to get some advice, we'll be happy to share that information. So we'll probably pick up a relevant topic, and then we will work on that so you guys can go deeper a little bit. Like, for example, just pick up laser-related issues or chemical peel-related issues and probably just go a little bit deeper. So thanks once again, everyone, for joining in. And that's the information that was shared by Dr. Debraj Shome for the skin-related issues. I just want to quickly highlight a couple of things, guys, since I'm here on the live. Hi, everyone. Thank you for joining in again. I believe all of you know that I'm running a mini coaching series. This is a mini series, and Julie was a part of the series. Julie has shared her feedback, which is on my Insta story at this point in time. The first session that we did was on goal setting. So our next session is on grooming, how to have impeccable grooming. And I just want to quickly share with all of you that I'm going to be sharing something very, very interesting in that session. I'm not going to be talking about makeup and normal grooming tips, but I'm going to be talking about something really interesting that you guys would have never heard before. So I definitely recommend that you should join that session, which is happening on next Saturday, 25th of July, 5 p.m. to 6:30 p.m. Singapore time. I'm going to be sharing a lot more details on my Insta stories in some time to come. So as I said, this is a mini series that I'm running every Saturday until the 19th of September. So we'll be covering confidence, we'll be covering body language, we'll be talking about public speaking, we'll be talking about question answers. So there's a lot more in store for you. So for all of you, if you're interested, go ahead and send us your email address. Go ahead and register for the webinar series on my website. And also there's another thing that I've recently started. I've started sending a daily email to all of you. You guys would have been receiving email from Vivek. You will be receiving a lot more emails from me as well. So if you want to be part of these daily motivational series that we have started, inspired from Julia George, of course, because I know she's been sending an email to all of you, and I think that's very, very good to engage, and that's what I wanted to do as well. We've started doing that, so if you want to be on that email trail, do go to my website and do give us your information. where it says, I want to know about webinar series, and we'll include you in that email trail. So we'll not just share information on webinar, but we'll also give you information on what are some of the things that you could do to keep yourself motivated on a daily basis. So definitely do that. Thanks everyone for the compliments. And about teeth requirements. In general, for cabin crew aspirants, there is no teeth requirement in particular, but of course, because smiling is an important part of our job as a cabin crew member. And when we smile, we usually will show teeth. So having a presentable set of teeth is what people look for, the interviewers look for. So as I tell everyone all the time, my lower teeth are not aligned, but when I talk, I try my best not to show my lower teeth. So these are some of the things that you could actually do. You don't always have to go for like surgeries and stuff like that to take care of your teeth. But having good presentable set of teeth is what is important. And when I say presentable, they shouldn't be yellow, they shouldn't be stain free, and things like that also plays a part. And it's not just about the alignment of the teeth that people always focus on. Thanks everyone. Going back to confidence, I just want to quickly share these 3 things with you. Confidence starts from within. Okay, you've got to believe in the person that you're looking at, and you've got to affirm that belief every day. That you're confident, you're beautiful, you can do it, you can take care of it. It is a daily thing. It's not something that you do one day and then you don't do the next day. It's a constant thing that you need to do when it comes to confidence and believing in yourself. So spend some time with yourself on a daily basis to affirm these positive thoughts, and that will definitely help you with your confidence on the inside and on the outside as well. The second thing that I always say is amplify your strengths. Work with your strengths. Everybody has different strengths. When you don't look at other people who are better than you, because that will definitely put you down. Look at yourself and see what strengths you have and how you can amplify them or use them to the best. And that will basically motivate you more. And if you have certain weaknesses, then work on them along the way so that they become your strengths at some point in time. And of course, the third thing that I feel is really, really important when it comes to confidence is having clarity in what you really want to do. Set goals for yourselves. Don't just blindly keep doing things in pursuit of wanting to get something. Set goals. If you want to remove, say, for example, if you want to get rid of some scar, set a goal. Okay, I'm going to get rid of my scar by this time. What am I going to do to get rid of that scar? Am I going to do DIY treatments? Am I going to see a doctor? Am I going to get the surgery done? Or whatever, for that matter of fact. So do that. Have some clarity. Thanks, Julie. Thanks for sharing. So how do you do? I'm not sure what that means, Aradhana. Aradhana, I'm not sure what that means. So I've answered your question about the teeth. I'm sorry, I'm touching my skin a bit too much because I came back from swimming and I didn't get the time to wash my face completely. It's a bit itchy right now. So I better go and take care of my skin right now. So thanks once again, everyone, for joining the session today. I'm going to save this live so you can get more information from what Dr. Debraj Shome has shared. And I'm going to be sharing a lot of information about the webinars and some interesting stuff that's coming along your way. We're actually going to be launching a very, very interesting thing. I'm going to be doing that with Julia, which is going to be announced, I think, tomorrow or day after. So do keep a lookout on my Insta stories, her Insta stories, and the feed as well. We're going to share that. And apart from that, one last thing. I always look forward to hearing from you guys. What is it that you want me to do in terms of the webinars and stuff like that? So there are forms on my website which says ask me, tell me. Go ahead and fill them up. And I would love to know that information. All right. Thank you guys. And once again, as I always say, I am very, very grateful that you all come to live sessions and take your time out. As much as I take my time out, or experts who come on to take their time out, I really appreciate that you guys take time out to actually watch the stories, look at my posts, and comment on them, and at the same time come and share your experiences, gain some knowledge, and share your insights. And I always feel learning is a two-way street. At the end of the day, sometimes I also end up learning a lot of things from a lot of people. And I love that process, you know. I'm not one of those people who just want to sit here and coach and guide. I want to learn as well. And I think you guys do a wonderful job when you do sharing, when you share your experiences. And that makes me learn a lot of things as well. So I think that's really important as well. To be confident, you have to be humble at the same time, which I truly believe in, you know. Yeah, believe in yourself, but believe in other people around you as well. All right, guys. So I think we're gonna bring the session to an end. Hi, Akriti. How are you? Yes, I'm gonna be doing a webinar with Julia very, very soon. We're supposed to do a webinar, but actually I had to run to the hospital. I don't know if you guys remember. I was supposed to do a webinar, but right at the end, last moment, I had to put up a post on my Insta saying I can't do it. I was actually at the hospital. Yeah. But I'm fine. I'm absolutely fine, taking care of myself. All right, guys. So thank you once again for joining in. And I'm going to be doing a lot more stuff. So stay in touch and take care of yourselves. Have a good Sunday evening. Get some rest. Get ready for Monday. And yeah, take care. Bye. Bye, guys.